Did you know that 80% of people suffer from low back pain? And one of the main causes of that is they have an anterior pelvic tilt, which often happens because of excessive sitting down. So maybe when you're driving, or if you're watching TV or playing a lot of video games, or doing things where you are in a constant sitting position. So the way to correct an anterior pelvic tilt, and the way you know you have one, is if your butt sticks out and your abdomen goes forward, and then it also causes a forward posture. So you look kind of like this, and it puts a lot of pressure on your lower back. So we want to bring it in and have it so that your pelvis is more in alignment with your chest. Okay? So I'm going to show you some exercises to do to help correct an anterior pelvic tilt. And this is called a foam roller. And it's great for myofascial release. So what you want to first do is roll your lower back. And you want to do this every day until you start to feel some relief, and then I still recommend that you do it regularly. So you just want to slowly roll. And if you catch a spot that really hurts, then I want you to stay on it for as long as you can. And you could turn your body to the side and kind of target one side versus the other side. And you just go really slow. Okay, so that's your lower back. And then you want to stretch your hip flexors, because your hip flexors are often tight when you have low back pain. And to do that, you just lay right across your hip flexor, okay? And then you roll back and forth really slowly. And again, if you feel a spot that's real tender, try to stay on it as long as you possibly can stand it. Okay, and then switch sides into the other side. So some of the stretches that you want to do after you've done your foam rolling are a calf stretch. So you would bring your abdomen and point it towards the floor and arch your back inward, and then you're going to arch your back upward, just like a cat.
And hold for a count of 3 to 5 seconds.
And then another stretch that you want to do is to stretch your hip flexors. So you just want to get kind of in like a lunge position. And then you can feel the stretch really strong through there with those hip flexors. And hold it for as long as you possibly can. And you can also bring your arm up and over, and that gives you even a deeper stretch. So once you have stretched your areas, then you're going to want to strengthen them. So one exercise that I recommend is just a dumbbell squat, and you want to go real slow and focus really focus on your form. Okay, you go down, and then you come up. And really focus on keeping your core tight and in alignment with your. And one of the other exercises that is great for correcting excessive anterior pelvic tilt is our glute bridges. So you want to lay flat on the floor, keep your pelvis tilted up, and then you're going to squeeze your glutes up until you're in alignment with your knee, your hip, your shoulders. Okay, and hold it for a count of 3 at least. Hold it for longer if you want. And back down. And it's a slow, controlled movement. And then you can go to one leg as you get stronger. Okay. And up. Another one of my favorite low back stretches that just really feels good is just pulling your legs in and hugging them with your arms. You can kind of rock back and forth. That's a great one. So these are some things that you can do to help correct that excessive anterior pelvic tilt.